Throughout this course, we've explored the impact of chromosomal mutations on multiple myeloma, but they're only part of the story. Gene mutations can also play a crucial role in the disease. In this HealthTree University lesson, we'll shift our focus to specific gene mutations that can be detected in myeloma, how they influence disease progression, and what they mean for treatment strategies. What should I know about gene mutations that can occur in multiple myeloma?
So a lot of what we've talked about has been, whole chromosome or changes in expression. But there are some mutations which don't change the expression of a gene, but they change how it functions. And the most famous ones would be KRAS, NRAS, BRAF, and some patients, in fact, with FGF receptor 3. They'll get a single nucleotide, a single amino acid gets changed in that protein, and it activates it so that the gene is like constantly on, constantly signaling, and it's constantly signaling growth. And so it's like putting your foot on the accelerator, and it's giving a signal to the cell that it should divide. In a lot of other cancers, there are targeted therapies which inhibit these activated proteins called kinase inhibitors. And so far, there don't seem to be any that are working particularly well in multiple myeloma. But it has been our hope that we would find some targeted therapy that would be active against these mutations.
Individual genes may have just a single code change, a mutation. That is a single change in a gene that can now cause that gene to function differently. Now, you'll notice that in this slide, I'm showing how common some of these are. And look at the top of the list is what's called KRAS and NRAS. Through research and understanding and testing what these genes do, we now understand that the RAS genes signal cells to divide and proliferate. And it's a normal gene in the normal genome, but in myelomas, oftentimes that gene is mutated, and it's mutated so that that gene functions at a higher level. Functioning at a higher level means it's signaling that cell to divide and proliferate at a higher level. That's what tumor cells do. That's what we don't want them to do. So there are a couple useful pieces of information here. One is we start understanding which genes contribute to the myeloma trait of its proliferation, or maybe its migration to the marrow. But it also gives us another useful piece of information. If I can block that KRAS gene and stop it from overacting, I might have an effective therapy. So in fact, a lot of research at academic institutions and at pharma companies are trying to develop drugs that will specifically target the genes that are mutated in myeloma so that the drug will stop that gene from functioning. And so there's a lot of research being done. You'll see a gene there called BRAF. There's actually a good therapy drug for the treatment of tumors that have BRAF mutations. So this is also giving us information based on the genetic mutations as to how aggressive the disease might be and what effective therapeutics there might be or what targets we should be testing to try to treat this disease.
How would someone know if they have a BRAF, RAS, KRAS, or NRAS mutation?
The only way that you'd find out if you've got a point mutation in almost any gene in multiple myeloma, like KRAS or NRAS or BRAF or P53, would be if you had sequencing done. Typically, it would be next generation sequencing, and you would want to include a variety of genes because most the only a few genes are commonly mutated. So NRAS and KRAS, that would be about 20% each. But then the other genes are, 10% or less. And so you really need to sequence a lot of genes in order to identify which ones might be mutated.
If you have one of these mutations, could you use a therapy from another cancer that's directed at that mutation?
Well, certainly there's a push to do targeted therapy in multiple myeloma. And what that means is to take drugs which are active maybe in other cancers against a given mutation and apply them to multiple myeloma patients that share the same mutation. Those studies are very difficult to do because any given mutation tends to be quite uncommon. But they are being done. There's a study from the National Cancer Institute called TAPUR, TAPUR. And these are very large studies which have brought together a number of different drugs. And the patients has their tumor sequence, and then the drug which matches that patient's mutation is used in the clinical trial. But I would say up to date, that approach has shown a lot of hurdles, a lot of difficulty in getting it done, and it hasn't had a lot of successes in multiple myeloma. And so I think we really need to, we need to do more studies before we can see that's ready for.
Why don't myeloma patients respond well to BRAF inhibitors? Is the BRAF mutation in myeloma different from that in breast or lung cancer, or is another factor at play?
Probably, there's some data from a few case studies where the patient has a transient response. But the issue is that the patient who's got a BRAF mutation, typically that's in a subclone, and there's another subclone that doesn't have a BRAF mutation. And so when you treat with the inhibitor, you just allow the other subclone to grow.
To track your genetic profile, sign up for a HealthTree account. Once your medical records are connected, you can view your genetic profile by clicking the Track My Disease button on your dashboard. You can also find personalized treatment options and relevant clinical trials based on your profile. Click the link in the description to join today.